something really hit me as you were talking. The issue of multi partners, but I want to go to the issue of homosexuality. We're talking about gay lifestyle, lesbian lifestyle, or homosexuals and so forth. I'm not going to talk about it religiously at this moment. Medically, using organs in places where they're not supposed to be, and their effects in relation maybe to cancer. Is there any studies?
Well, we know very much there is a good link between homosexuality and HIV and and AIDS and homosexuals. I mean, they do develop some kind of viral infection. Human papillomavirus that cause warts, genital warts, and the herpes, and I mentioned HIV. If I try to link that with cancer, then we talk about, I mentioned that AIDS patient develop some kind of a lymphoma and a skin cancer called Kaposi sarcoma. So immunocompromised, just being immunocompromised, no immunity, that means that is a good, that's a good time for the cancer to grow.
Excellent, good. I do have a lot of callers. I got Salim.
Yes, my name is Dr. Salim Shazad.
Assalamu alaikum.
Walaikum assalam.
How are you?
Good, very good. I think it's a very important topic you guys are talking about today. And sometimes we know that some of the cancers, they just pop up. You go for some examination and you look for a problem and you find that the person is having this problem. So would you please comment and emphasize that how important it is that person should be going and follow the guidelines for prevention, that how we can detect these cancers early and can be prevented.
Thank you.
Thank you, Dr. Salim. Thank you for bringing me back again to screening, and I actually try to highlight that. The best treatment for cancer, the best treatment for cancer is to find cancer early. If you're going to have cancer, if I have to have cancer, I may not change that, but I can find it early at least. If I have to have cancer because of something hereditary, or if I smoke, or if there is any reason to cause me to have a cancer, then it is the best to find it early. So there is some guidelines, at least, for example, for breast cancer. Every woman should have a mammogram. Of course, I will go back. Every woman should have a monthly self-breast exam. In the shower, examine your breast. With the right hand, examine the left breast. With the left hand, examine the right breast. Feel under your arm. When you lay down in the bed, you can do that. It is a very most of the breast cancer diagnosed by the woman herself. Find the lump. Look in the mirror. If you see your breasts are different, there is a change in the shape of the breast. After you have a shower, stand in front of the mirror, look, and put your hands in your waist and look. If they're not symmetrical, if there is a change, that is, you have to see your doctor. So monthly self breast exam, physical exam by your doctor, family doctor, just at least once a year have a breast exam. At what age? Usually 40. From 40 you start 35, 40 you start have a breast exam. After 50, definitely you should have it. After 50, you have to have an annual breast exam by your physician. What else? Mammogram. After age of 50, you have to have a mammogram. Very simple X-rays of the breast that is can find cancer before it show up. Then you diagnose cancer early and you cure the cancer. So I don't have to give you chemotherapy if that happened. That's for breast cancer. Colon cancer. Every person should have a colonoscopy by age of 50. If there is a family history of that, 10 years before that should have a colonoscopy. This stood for occult blood. I'm sure Dr. Salim does use those for his patient. This is once a year you should have that. It's very simple test. They give it to you in hand, you take it home, bring it to the lab in an envelope. They can test it. If there's any blood on it, then you go and have a colonoscopy. Lung cancer. unfortunately, we do not have a screening for that. In Japan, they try to use CT scan, but it is not cost effective. You spend millions of dollars to diagnose few people with cancer. So there is no screening for lung cancer. Stop smoking. That's the only thing. But if you smoke and you know that you are not planning to quit, see your doctor. Examine your lung. Have a chest X-ray once a year. This is not guidelines, but this is my own advice. Just see your doctor. If you smoke, see your doctor. Have a chest X-ray. Prostate cancer. See your doctor. He will order a PSA, which is a very simple blood test. They just take it from your arm, send it to the lab. There's a blood test called PSA that can detect cancer early beside doing an exam, physical exam at age of 50, at age of 40 for African American, or if there is a family history of prostate cancer. Skin cancer, your doctor can just see your skin. If you have any mole in your skin, dark spot, that is start the itchy, bleeding, changing size, changing shape, anything like that, that has to come out. And family doctor can remove that in the office. And believe me, this is a cancer which is only millimeters. That is can kill you. Only few millimeters. That is can go to the brain, can take life. Those are the main cancer, but routine follow-up is really very important.
Again, we are with Dr. Elshami Elamin. We ran out of time. I do have Sue online too. Sue, call the show again after we close here at 267-8855, 267-8855. The doctor will give you a special advice, a private advice, one-on-one, right after the show. Again, live healthy, don't smoke, don't drink.